Good afternoon, everyone. It's Tracy Kawa with American SPCC and A Brighter Future Starts Here podcast. Today, we are very happy to bring you Dr. Jay Harvey of Cohen and Schenker Pediatrics to discuss kids and COVID. Thank you so much for taking time out of your extremely busy schedule, from what I understand at this point in time, to be with us here today.
Totally. My pleasure. Thank you for having me.
For sure. And such a timely, relevant conversation, especially as kids are going back to school. So what are we currently seeing insofar as the healthcare trends regarding kids and the Delta variant?
Yeah, so the Delta variant has been a big curveball. Things were trending pretty well up to about March, I would say. Numbers were down, caseloads were down, hospitalizations, death rates, everything was down. And it appears as though we may have celebrated just a little bit prematurely. Because ever since about April, as people started unmasking and socializing and sending kids back to school or preschool or daycare, there's been, I guess the word I would use is an explosion of cases and illnesses, not all of which are COVID, but a large number of which are.
And they were talking about that in the news when the variant first, when COVID first came out. They were saying that it was going to go through a couple of these, horrible cycles.
Yes.
Right? But then when we thought that we all had it under control with the vaccine and
the vaccine efforts definitely helped a lot. And when administrations changed, there obviously was a concerted effort to get a lot of people vaccinated. And for the first month or two, millions of people a month were getting vaccinated, which obviously helped. But then again, as numbers drove down and different states took on different, types of approaches to the pandemic, that's when kind of the bottom fell out. And I think a lot of that was because as these variants emerged, just was when COVID-19 emerged, we never had COVID-19 before. So an expert on COVID-19 has been an expert for 18, 19, 20 months. Right. That's the extent of it. And then when you add in a lot of these mutations and variants that are occurring for a variety of reasons, each new variant requires its own new study group, if you will. And I think what they did not know, but they do now about the Delta variant, is that it's more than 1,000 times more transmissible than the initial strains that were present. And when you think back to last March, April, May, when you saw as things were, going across the country, how rapidly people were becoming infected and falling ill, 1,000 times more transmissible. It's hard to even comprehend, but it's made a significant difference.
That's scary, and it's hard to fathom.
Yes.
What is the difference between this go around with the Delta variant and the original COVID?
So the difference in terms of transmissibility seems to be that, as is the case with a lot of viral illnesses and infections, viruses are pretty smart. They've been around long before we were, and they're going to be around probably long after we're gone. And their ability to learn and mutate according to their environment and their circumstances far outpaces our ability to match that and try to block them. And this particular variant seems, very astute at evading the various parts of the immune system that are sent out to detect invaders, including if you have antibodies to the earlier strains, it's become evasive. And I think when you add that to the increase in the transmissibility, the ease with which people can contract it in their nose and their throat, even from seemingly brief or incidental contact, you put those two things together and you have what we now have, which is higher numbers than we've ever had since the pandemic began.
Talk to us about the hospitalizations. More hospitalizations now?
There's obviously the hospitals are filling up. There's a variety of reasons. Certainly the hospitalizations clearly appear to be higher in states that are not doing as well in terms of vaccinating their population. And that's sad and unfortunate because we now have a vaccination that
And
we
it's very telling. That's very telling.
I think it's very telling. Most of my, colleagues in this profession think it's very telling, and it's very sad and it's very distressing because whether it's a child or an adult, many of these hospitalizations and deaths seem clearly preventable to us. And obviously, we'll get into the alignment of the healthcare system and the government with, various healthcare entities. That's certainly played a role, but I just think it's a microcosm of where our country seems to be in terms of people having belief or lack of belief in different entities or experts. And it's sad because, again, this is not, thankfully, Ebola with a 90% death rate if you catch it. This is something that we have the means to prevent people from going into the hospital. And look, even if you go in the hospital and survive, you're probably going to have a huge bill. And obviously, it puts a strain on resources. The hospitals don't have the nurses, don't have the techs, they don't have the people to keep up with this massive demand. So if you have a run-of-the-mill heart attack, good luck getting an ICU bed or the type of care that you need. So it's a very interwoven web that is weaved, and there's a lot of ramifications outside what you might immediately think of. So specifically with Delta variant, the burden has obviously shifted to the younger populations, both younger adults as well as children, unfortunately. And that's a byproduct of two things. One, there's been a concerted effort to immunize the elderly. Appropriate. They certainly seem to be at the highest risk, and a lack of availability of immunizations thus far for kids under the age of 12. And also, sadly, a less than robust in certain areas willingness to vaccinate kids that are above 12 years old. Match that with loosening of the mask situation, banning of mask mandates in certain states, and including the wonderful Sunshine State of Florida here, and people having their own, opinions, obviously, about the good, the bad, and the ugly of masks and distancing. Kids not going back to school, summertime, people going indoors because it's too hot outside, and the recipe for what is now before us becomes apparent.
Right. It's always sad, like you had mentioned earlier, when something is preventable, when it just didn't have to happen, yet all precautions were not taken. I, as the mother of a 12-year-old, my son was homeschooled all last year, which was difficult enough.
Oh, yeah.
And now he just received the vaccine in June.
Excellent.
And he just started brick and mortar school. He's back in physical school this year. And at least twice a week, the telephone rings with a pre-recorded message. And I know what that message is going to say.
You know what it's going to say, yep.
That, another person on the campus has been diagnosed with COVID, and it's scary. It's very scary.
It is. And again, look, that can happen even in ideal circumstances or situations. Nobody is talking about, being COVID-19 proof, because you could be following all the recommendations and rituals, and look, it could still happen. That said, I believe, as do many of my colleagues, that many more cases can be prevented if appropriate precautions are taken, from vaccination to masks to distancing, appropriate cleansing, appropriate contact tracing, quarantining, et cetera. And look, does anybody want to do it? No. Join the club as far as that goes. But, are we really asking that much, to wear a mask? And then that doesn't minimize the long-term effect that it has on kids. And if you have a speech problem, you can't see the teacher's lips. And look, there's a million ramifications, just as there were ramifications to isolating kids and not allowing them to go to school. I think those ramifications vary a little bit based on the age of your child, but it's still not normal. And nobody felt like kids shouldn't go back to school. We know in the end that's the best thing for them. The question became, how can we do that as safely as we can possibly do it? And to see the resistance to that justifies logic. And in some cases, it's because people don't understand. In some cases, people believe what they just prefer to believe, whether it's about our government or about big pharma or about so-called medical experts, and whether they're on the take or they're not on the take. And look, corruption exists in every walk of life. Certainly the medical profession, the pharmaceutical profession, the government, no one is immune. And I guess if you take that to its extreme, that's where all your conspiracy theories and things like that come from. That's a pretty grim worldview, in my opinion.
And weekend, right?
So, yeah, I mean, I have met enough people along my trail from the time I was in college to medical school to residency to now my career to know that, not everybody who's in these fields is evil and greedy and, only has a profit motive. Certainly that exists, but there's plenty of good-hearted, good-souled, hardworking people who just want to keep people safe or cure people or prevent disease. And I just hate to see them just get washed over in this siege of disinformation and misinformation that exists.
Yeah, and that's a great point. And the truth of the matter is there is a lot of disinformation and misinformation. So you really have to weed through the sources and go to reputable sources. And I'm glad that you touched on, a lot of good-hearted people that are out there, because that's exactly what I was thinking when you sent over that great article right before the show about how our readers would love to read, about what to expect with kids going back to school, and God forbid your child is diagnosed. So thank you for your big heart and for sending that over to us. And we'll be sure to post that.
Excellent. My pleasure.
Yeah. So tell us a little bit about underlying conditions, right? Some people will attract COVID if they have underlying conditions and others may not. Or is it that the cases are worse if they have an underlying condition? And then to add on to that, what's the difference between the Delta variant and these underlying conditions versus COVID originally with underlying conditions?
Good question. So I think it's more the latter. I don't know that people with those kind of pre-existing medical conditions are necessarily attracting COVID more readily or more easily than someone who does not. But very clearly, they are experiencing much more severe COVID infections, and of course, in some cases, losing that battle. In particular, diabetes and obesity and heart disease seem to be the big three. Interestingly, lung diseases such as asthma, while suspected of being an additional risk factor, the data has not been as overwhelming in that regard. But it stands to reason, since COVID obviously can affect your lungs and your breathing, that it's probably not to your advantage to have asthma or COPD or something like that. So, but the big three seems to definitely be diabetes, obesity, and heart disease. And in the case of children, I think this is, at least in part, explains why kids don't get as sick. Because hopefully, if you're 5 or 10, you don't have diabetes, you're not obese, and you don't have heart disease. So just by virtue of those things not being present in kids, I think that's a component of what explains, why they don't seem to get as sick. There's many other factors, I think, and that is something that is being researched very intensively now. What can we learn from the fact that kids have not been, thank God, as severely affected as adults? I'm sure there's wisdom to be gleaned in terms of why that is. And in fact, one of the theories I've read is that because of the fact in some instances kids might have a weaker immune system than an adult, a full-grown adult, that may benefit them.
Wow.
And here's how. One of the things that was learned relatively early in the pandemic was that in people who were hospitalized, intensive care, and many of whom passed away, part of what may have actually harmed them was not the infection itself, which was bad enough, but was a hyperactive immune response, a so-called cytokine storm, the technicalities of which we don't need to get into. But it was an exaggerated immune and inflammatory response that actually caused their organ failure. And children, especially the younger they are, do not tend to have those types of capacities in their immune system yet. And so in a strange way, being a little bit weaker in their immune response may have benefited them in terms of not getting as sick.
Fascinating. It's almost like saying their immune system is more malleable and can adjust to what's happening.
That is very perceptive, because that is true, because there are many other theories, because we have multiple components to our immune system. It's not all one thing. There's plasma cells, there's like antibodies, and there's T cells and memory T cells and neutrophils and macrophages and all different types of things, and they all have their role to play. And another theory at least, as to why kids don't seem to get as sick is because as compared to adults, these white cells known as neutrophils and macrophages, they're kind of generic. In other words, they're not stamped, go kill the flu, go kill chickenpox, go kill whatever. They're just like, oh, we detected an invasion. Let's go see if we can just round that up and, get rid of it. And that response in children is very robust. Whereas in adults, it's not as robust. The older you get, the less robust it becomes. And so another one of the theories is, the kids catch it just as easily as adults catch it, but that early response of those generic, let's mop up the invader, rally very quickly, reduce their viral load, and perhaps play a role in them not getting quite as ill also. So again, these things are not necessarily carved in stone. These are different theories that I've read, but I have a feeling as more is studied, it's probably going to be multiple reasons and not one reason why kids have dodged the bullet. Because, if you look at it in the reverse, there are some viral illnesses that are way more harmful to babies and kids than they are to adults. Take the flu, for example. The vast majority of healthy adults, they'll be sick for a week and then they're better. But if you take an infant or a newborn or whatever, and they get the flu or they get RSV, which is another viral infection that's been very prevalent these days, they can get very sick or die. Why is that? You know what I mean? And I think differences that are inherent in the immune responses of babies, children, toddlers, young adults and adults undoubtedly are playing a role in that. With respect to the Delta variant and its lethality as pertains to children and adults, again, everybody should say this, it's on TV or on a podcast, according to current information, because we may learn something new tomorrow, the Delta variant does not appear to be more lethal. Does not appear to be causing more death or hospitalization, particularly in children, than any of the prior variants were, which is good news.
Thank God to that.
There's no doubt. However, you're seeing the disease burden shift to children because obviously a lot of the older population is immunized. And if you're in a community or an area where that's, say, 80% of the people around you, the kids probably aren't getting hospitalized or getting very sick. If you're in an area where vaccination rates are lower and perhaps the protocols and guidelines as far as masking and distancing are less intense, more flexible, more loose. Sad to say, but states like Louisiana and Alabama and Florida and Texas, sorry, folks, those are the states whose ICU beds are almost gone. Those are the states with the highest number of children hospitalized. Those are just, them's the facts. It's not an accusation. It's not an allegation. That's just the facts.
Again, so, very telling.
Take it as you will, right?
Yeah, just go according to the facts. What do the facts speak of? They speak of the fact that, the communities that have the higher immunization have less people in the hospitals, have less people in the ICUs, have less people with the COVID.
There's no question.
That's the fact.
Them's the facts.
Right.
Yeah.
So tell us a little bit about yourself. You've been in practice for 30 years. God knows you've seen it all. And how do you help parents make the best decisions for themselves?
Well, yeah, I have been in practice for 30 years now. That's hard to believe, but
Right.
no less true. I guess I ain't getting any younger, but that's just the way it goes. And yeah, I've seen a lot, but we've certainly not seen anything that remotely resembles, this scenario. We certainly could have all done without it, that's for sure. But it does teach you things. Everything that you experience in life, there's a lesson to be learned if you're willing to learn it. And one of the things that I think strikes me about this pandemic um, is that you have to meet people where they are. Everybody's individual life circumstances are different, their upbringings are different, their parenting styles are different, the people they interact with are different, their risk tolerance is different. And if you just try to, cookbook it or blanket it with some type of, universal approach or protocol, not only is that not going to work, I don't really think you're doing your families a service.
Mhm.
So I think one of the most important things is you actually have to talk to them, and you actually have to listen, and you actually have to understand where they're coming from, know what their family circumstances and dynamics are, and do both parents work? Do they not? Or do they associate with vaccinated or unvaccinated people? What is their risk tolerance? Do they don't want to go outside on a rainy day, or are they throw caution to the wind? Are they somewhere in the middle?
Meaning
Uh,
the right.
yeah, and unfortunately, to some degree, if you can glean them, you have to kind of take their political views into account as well, because that, unfortunately, this has become very politicized. And if you speak through only your own lens, if I were to just give them, you know, my personal feelings, my professional feelings about how I think this should be approached, without first exploring where they're at in their life and in their mind and what they believe and what they think, that information, true though it may be, is not likely to be well received. So I think, my goal is to have the greatest positive, impact and effect that I can. And that doesn't just mean trying to impart credible information and trying to stay up on the changes that happen every day. That's all important and part of my job. But in order for me to really do my job well and the best of my ability, I have to understand where my parents are coming from. And I have to understand their perspectives and their life circumstances so that that advice hopefully makes a better fit. And look, if they're not going to vaccinate, then maybe they'll be stricter with masks, or if they'll wear a mask, but they won't you want to give them the information and explain why you think it should be done. But you're also looking for what they will actually absorb and do. Because if they just nod their head and they're not really hearing what you're saying, what have you really accomplished?
Accomplished.
So.
That's amazing. I love the concept of meeting your patient's parents where they're at, because it sounds like in a way you have to relearn each individual set of parents and understand how to deliver the information, what they'll absorb, what they'll apply, because you can talk to them all about masks, but if they're really wanting to talk about quarantining, or they firmly believe in not going to school, a physical school, but instead
Or maybe they think masks
learning,
are a waste of time, or whatever. Who knows?
or whatever it is, but
Right,
meeting them
right.
where they're at and speaking to them in a way that is relatable for them.
That's exactly right.
Yeah. And speaking of which, it sounds like you have found the perfect practice for yourself, because the practice that you're with, Cohen and Schenker,
Hmm.
tell us a little bit about it. It's not your average pediatrician's office.
Well, we'd like to think not. I think, look, we're board certified pediatricians, and there's certainly many excellent ones, in our area, in the, Boca del Rey, et cetera, area. So, who are doing a great job. It's not to say that we're better. I don't want to put it like that, but I think where I and my colleagues try to distinguish or differentiate ourselves is with the kind of thing that we were just talking about. I think, speaking in general terms, primary care is undervalued and underappreciated in many different ways. And yet we're the ones who, in theory, when managed care came about and stuff, we were supposed to be the gatekeepers. We're supposed to be the ones who actually took the time to get to know our families and figure out what's in their best interest and direct their care. That model, in my opinion, hasn't exactly worked out that great because of the fact of the way the corporatization of medicine has gone and reimbursements kind of lagging and going backwards. The pressure on primary care doctors and pediatricians just to see more people in less time has increased dramatically over the years. And let's face it, if you have to see 30 or 40 or 50 or however many patients a day you're seeing, unless you're planning on being 3 hours behind, which will not likely attract more patients to your practice, you only got so much time, with each patient, whether it's a routine well check, a sick visit, whatever the case may be, a consult visit. The one thing you can't manufacture or get back is time. And the way that I have approached the way I do things for 30 years, which I've always kind of felt a little bit like a square peg in a round hole, is because I like the older style of medicine. I like where you actually do talk to people, not even necessarily about what's wrong with them or their kids. Just like, hey, how's your job? Whatever. How's that going? I know your mom, was sick. It's like, not only is that to me the essence of pediatrics, I think that's what builds the bond and the trust over the long term. And then when you are communicating something of importance or value, I think you're heard, respected, trusted, even if you're not agreed with. That mutual trust and mutual respect, is there. And I think there's no way around the fact that takes time. And if you're standing up to leave, 5 minutes after you've walked in, it doesn't work, in my opinion. And I will say some docs that I know do a really great job in a very short period of time. You probably can tell I'm a little verbose, so that's probably not me. But I do think patients who like us, like our practice. You okay? I'm getting a little reverberation.
Are you?
Yeah. Okay, better. Thank you. Yeah. So I think the people who we attract, let's say, are people who talk to the doctor. And they want to have the questions answered and not get rushed out the door.
Got it. So, and like we were talking, a little pre-show, Cohen and Schenker acts as, a little bit more like a concierge practice, right? So if any of our listeners want to reach Dr. Harvey, this is where you can find him, Cohen and Schenker. And so let's talk a little bit. I've heard you kind of touch on politics, kind of a roundabout way. So do you believe that there is an alignment or a misalignment between what the healthcare experts are saying and our government leaders, what they're saying?
Well, I think it's pretty obvious there's a misalignment. It's complicated, though. I think in some cases it's purposeful and purely for political gain, which is reprehensible, in my opinion, because your number one job, in my opinion, as any elected official, whether you're the president, the governor, the senator, should be the safety and well-being of your constituents. And people who put their political ambitions or motives ahead of that, focusing more on power, greed, control, which I think is unfortunately quite common. Yeah, you shouldn't be there, in my opinion. And we shouldn't place our faith and trust in people who are going to behave in that fashion when push comes to shove. Of course, while they're getting elected, they may not reveal that side, and you're
Yeah.
left to kind of contend with
Right.
it after the fact. But once it has been revealed, it just becomes incumbent upon the constituents to decide if that's a person they want to continue to have representing their interest or not. And I think if that becomes clear, the answer should be not. So that's one. And I think that's, doesn't just apply to issues within our healthcare system, but clearly there's plenty of conflict and controversy to go around in many other areas of how things should be done, in this country. So, and look, it's all up for discussion, but there really isn't much discussion. It's more attack and criticize. And part of the problem is nobody's really listening. Everybody's kind of stuck in their own silo of beliefs. I'm probably guilty of that to some degree myself. But if nobody's talking to anybody and nobody's trying to find any kind of common or middle ground, we will spin our wheels. There's no question, and we're not going to make a lot of headway in pandemic or any other areas that we'd like to see improve. So that's one. I also think part of the issue comes from a regression of trust in not only elected officials, but in public health officials. Obviously, Dr. Fauci, who I have a lot of respect for, has come under tremendous fire, for flip-flopping or going back and forth, or worse, according, to some other areas, if you listen to them. And I think part of the problem with him, the amount of knowledge he has from his 45, years of experience, dwarfs certainly my own and dwarfs the vast majority of the people who've been attacking him. But I will say, and it's not just him, I think there's many prominent people who go on television or radio and they have a big platform, especially with regards to the pandemic. They were stating things at different points in time as if they were as if it was a foregone conclusion, and it may have been at that moment in time, but a lot of the experts, I don't think, were taking into account how rapidly things were changing and how information was accumulating. So instead of saying wear a mask or not wear a mask, let's say, for example, what I would suggest they say is, according to all the evidence and information we have right now, today, this is what we recommend. Please stay tuned because we're accumulating and evaluating and analyzing information every day, and recommendations may change based on how we interpret and dissect that information. So when you do that, some people could say, well, you're fumfering, you're not being definitive. But on the flip side, when you say wear a mask and then, contrary evidence comes to light and people jump out, well, now you're a liar. So I'd rather be a fumferer, than a liar. Because if people think you're lying or you're disingenuous, they're no longer listening, as far as I'm concerned.
Right. I think to your point, people lose trust if one day wear a mask, the next day don't wear a mask. Whereas I love the way you frame that up based on all of the information that we have today, and with today being the key word. Today, because tomorrow it might change, and we all need to remain flexible.
Yes, I think that is the way that hindsight's 2020, but I think that is the way that I would have chosen to portray the information. Everybody wants, especially in the beginning of the pandemic where nobody really knew anything other than people were dying at a rapid, pace. People are scared. And rightfully so. The doctors were scared. Everybody was scared. So, because we didn't know what we were dealing with either. You got the hazmat suit, and you don't know if you're going to make it. Your family's going to make it. Are you going to give it to them?
There's the nurses that were dying from COVID. That were catching
100%. First responders, all that stuff.
Sure.
So that does call for healthcare experts and elected officials to be calm, at least publicly,
Yeah.
so that people don't completely, fritz out. And certainly people at that moment are looking for authoritative, credible, definitive information. But I think you're obligated to say, as you attempt to present that information, that this could change. This is a dynamic, not a static situation. We are gathering information literally every moment of every day against a virus we've never seen before. This is not flu. And look, flu messes with us, every 100 years or so as well. But we got a better handle on that. We even have a better handle on Ebola and a bunch of other, horrific, contagious diseases. But this one, it's right out of the gate. What's this?
You're really making me think about something, which is that we are such a fast fix society that we designate one person as the expert and then we want the answer. Right now, right here, give me the answer. And I want the long-term answer, not the short-term answer.
You're correct. And look, that would be great, if we can do that. But I think we have to acknowledge the fact that we're human. And we don't know everything. And for everything we know, there's probably at least one thing or 10 things we don't. And so we have to, and that goes for the experts down to, the person on the street. So that's just a fact of life. We'll never know everything there is to know, but fortunately, we're capable of learning. Fortunately, we're capable of analyzing and interpreting. And granted, things sometimes two people can look at the same thing and come to different conclusions. That's the next part. But I think, again, if you're honest about that and you are transparent in terms of how you're making your analysis, and then you're telling people that, look, this is based on everything I've been able to analyze so far, stay tuned, you've done the best you can do. Are you not supposed to contradict yourself if new information comes to light that, seems to counteract the information? Like, what's your choice? I think you're obligated to be honest. That's what I think you're obligated to be. And that includes acknowledging that you may not know everything that you need to know to give the best possible information, but I'm going to give you the best information based on everything I do know right now, because there's nothing else I can do. So, yeah.
Well said.
So, and I think the last problem that causes a lot of the issues is that this is America. And I love America. And,
God loves America.
Land of the free, home of the brave, but we do not have a centralized or uniform healthcare system. We have a very fragmented healthcare system that has behind it a profit motive. And all of those profit, and I'm not saying there aren't healthcare motives behind it as well. I think there are. But I think that this is just me, my perspective. The incentives are not aligned for us to have a non-dysfunctional, disparate healthcare system. Whether you're talking about hospitals, whether you're talking about insurers, whether you're talking about providers, whether you're talking about patients, some of whom are quite motivated to take care of their own health, and some of whom couldn't give a hoot, one way or the other. It all factors into the equation. In terms of what we listen to, what we don't, what we believe, what we don't believe, what we avoid, what we're attracted to. And unless, you have a centralized, healthcare system, which, most people don't seem to want, socialism or that kind of thing. I'm not saying I do.
I understand.
But one of the advantages of such a system is there is one voice disseminating all of the information to all of the people. And hey, it could be right, it could be wrong, it could be in the middle, but it's one voice. You can't go to this channel and get this voice, go to this channel and get this voice, go on this website and get this voice. I mean, good luck,
we're just talking about less confusion.
Correct.
It's speaking to less confusion.
Less confusion. And again, certainly there's flaws in that as well. But at least when there's one voice, or if you're trying to enact something publicly, some sort of public health policy, whether it be vaccination, whether it be whatever, it's like that central unifying voice makes it a lot simpler. That's for sure. So I think all of those things conspire, pardon the pun, to cause a lot of what we're seeing in terms of people just having very disparate beliefs and points of view in terms of how we should approach this pandemic.
Thank you for that.
Yeah.
You raise very valid points, a lot to think about.
No doubt.
For our audience to think about. So tell us, as kids are going back to school and as we wrap up the interview, what are some of the things that parents should be keeping top of mind?
So I think the first statement is kids should go back to school. If it's, within the parents' purview to send them, they should go. A lot of the considerations will depend on how old is your child? Above 2, younger than 2 is the first thing, because above 2, you get into the should be wearing a mask situation. Under 2, it's not something that's recommended. So that's part one. And then you could also get into, well, what kind of mask, which that's a whole nother conversation, because there's a lot of information about that, and I'll touch on that in a second. But then, are you comfortable with your child wearing a mask? Do you want your child to wear a mask? Do you want to put your child in an environment where masks are not required, either of the children or of the teachers or, assistants or whatever the case may be? And also, what is the policy of that particular school or county or city in terms of vaccination, at least of the employed people? So this gets into, I think those are things, if I'm a parent, those are things I want to know. I want to ask myself. But that all ties into what is your personal risk tolerance, if you will. And also gets into how do you perceive this virus? There are many who I've talked to who still are of the belief, well, the kid will get a cold and he's healthy, he'll be fine, whatever. They're not too worried, not too concerned. Others, they don't want their kid to leave their bedroom, never mind the house or, go there. And then obviously there's millions of people who are, somewhere in the middle and trying to, thread the needle of, I want to take some precautions. I don't want to go crazy, whatever, and I want to live my life. But so I think for each, and this is what I was getting to earlier about meeting people where they are, because I think everybody's different. How do you view this virus and this pandemic? How worried are you about your child contracting it and whether they might get hospitalized or worse? And granted, is it likely? No. Is it possible? Sure is. And another one of my famous sayings, if something's 1 in a million, that's pretty good. You're not too, but if your kid is the one, the other 999,000 quickly become irrelevant. And while certainly no one expects a tragedy to occur, but I think you're naive if you just take the approach, well, that's just not going to happen, because it's probably not, but it's not a guarantee, that's for sure. And so one of the things, it's the same with vaccinating for other diseases. Well, if your child gets a preventable disease, you're all right with that? Knowing that you, as the guardian, the parent, the protector, of the child,
should have, would have
prevented it. I mean, are you gonna sleep it? Are you gonna be okay? Whatever. And those people are typically more focused on, well, the vaccine can cause harm and blah, blah. And then we get into the statistics of, well, the likelihood of that, certainly something catastrophic versus, the other. Where do you want to, which basket do you want to put your eggs in, so to speak?
Right. Where do you draw the line?
Exactly. So I think for the parent, the main thing is talk to your spouse, talk to your inner circle that are involved in your life on a daily basis, your grandma, grandpa, aunts, uncles, friends, know where they're at, with their approach and how much they're following safety protocols and precautions. And then you have to find your particular comfort zone. What is your risk tolerance? How far are you willing to go to protect your child? What are you going to expect of others who your child is interacting with on a daily basis? And then what I also tell people is, because they say, I just want to make the right decision. I say, there is no right decision. You want to make the best decision given your circumstances, your loved ones, your family, the decision that you can live with. And then you make that decision and you deal with what comes after that. And so I think it's worthwhile to know as much information as you can, talk to people you trust. But at the end of the day, you have to decide where you're going to place your priorities and what you're going to be comfortable with moving forward.
And you are a wealth of knowledge, but actually more like a conduit, right, for all of the information to kind of come through you. You're more like a filter of the information that then you're disseminating out, really.
We try to be. We try to see the forest from the trees. And look, we're human. We don't know everything either, but we're certainly, I think, committed and motivated to try to give our parents and our families, the best information that we're capable of giving.
You raised something before, and I just want to circle back to it really quickly about the masks and all the different types of masks. Is there one specific type of mask that children should be wearing?
Yes. So this is another great question. And I liken it to, I get asked a lot of times for parents who are going to formula feed their babies, what's the best formula? And I usually say, well, the best formula is the formula the baby takes the best. Obviously, there's a lot of competition and similarity amongst the formulas. And I honestly believe, for the most part, they're pretty similar. And if your baby's taking it and growing and thriving, doing fine, that you don't need to change anything as far as that goes. So when it comes to a mask, the first and most important thing is your child going to wear it? Because if they're not going to wear it because it's uncomfortable or itchy or this or that, the whole thing goes kaput.
Smooth.
Yeah. So that's the first thing. So comfort is one thing. Second thing is fit. I've seen some parents with the best of intentions have the kids come into the office and their mask is like twice the size of their face, and it's hanging off the sides and this and that, and you might as well not wear anything. And then third, of course, gets into how well does it actually filter the viral particles. So real quick, the best masks are KF94 is one, and the KN95 is the other. These, if you just type it in, there's plenty of places providing these. These are the best in terms of the protection or filtration in terms of blocking viral particles. Doesn't mean every kid's going to necessarily take to them. For kids, it has now recently become pretty conclusive that surgical masks stand above cloth or fabric masks.
Is that this kind?
That would be a perfect example of a surgical mask, yes. The filtration of the triple layer surgical mask seems to be better than the cloth mask. But again, not every kid wears it. It doesn't always fit perfectly. So what a lot of parents are doing, and I think is not a terrible idea, is you can put a surgical mask on your kid and you can put a cloth mask over it, because that helps to kind of tape down the edges and prevent those little leak spots where viral particles can get through.
Got it. Well,
that's the quick summary. Yeah,
that was great. Thank you. We really appreciate having you and your expertise on the show, and hopefully we'd love to have you back as things develop. Maybe give us a little more insight every so often on what's happening.
Sure. That would be my pleasure.
Yeah. So again, I'm just going to flash this really quick about if you want to reach Dr. Harvey. He's at Cohen and Schenker. We can reach www.cohenandschenker.com. And to find more positive parenting resources, visit AmericanSPCC.org. Flash that right there. And you can find more wonderful resources and wonderful interviews on our podcast. And just remember, we're here usually every Wednesday. Today, thank you for joining us, and we know that it was very difficult to arrange your schedule, and we really, really appreciate the time that you took out of your day. So usually we're here Wednesdays at 2 p.m. at American SPCC Facebook Live. So again, thank you for joining us, and remember, a bright future starts here. Thank you, Dr. Harvey.